Look at your cat sleeping in that sunbeam right now. They look completely peaceful. Their fur is clean, their breathing is slow and steady, and when you walk by, they give you that tiny, contented chirp and roll onto their side. To your eyes, they look 100% healthy. You think to yourself, everything is fine. We have our annual vet checkup in 6 months. They are eating, they are purring, there is nothing to worry about. Now, let me show you what happens in veterinary clinics across the world every single day. 3 months later, you notice your cat didn't finish their breakfast. The next day, they are hiding under the bed. You bundle them into their carrier, rush to the veterinary clinic, and sit on the cold examination room bench while the doctor draws blood and runs an emergency ultrasound. 20 minutes later, the veterinarian walks in, closes the door quietly, and gives you the diagnosis: your cat has stage 3 chronic kidney disease. Or, your cat has severe, painful tooth root resorption in 3 molars. Or, your cat has advanced abdominal lymphoma, and their red blood cell count has dropped into critical anemia. You sit there in stunned, suffocating disbelief. Your voice trembles when you ask, how is that even possible? They were completely normal last week. How did this happen overnight? And the veterinarian gently places a hand on your arm and says the words that will break your heart: it didn't happen overnight. This disease has been quietly destroying their body for the last 8 to 12 months. That moment, that sickening, hollow realization that your cat was silently suffering in front of you while you smiled and petted them, is the single greatest tragedy in feline ownership. And here is the clinical truth that almost nobody tells you: cats do not get sick suddenly. They hide sickness until their internal organs have lost up to 75% of their functional reserve. They leave tiny, subtle physical clues across their mouth, their lymph nodes, their spine, their litter box, and their coat. Microscopic breadcrumbs of disease that take less than 2 minutes once a week to uncover if you know how to perform a clinical home audit. Please, take a slow, deep breath right now. If you have lost a cat in the past to a disease that seemed to appear out of thin air, release the guilt. Cats evolved over millions of years as solitary desert hunters. In the wild, showing pain, weakness, or organ compromise is an immediate death sentence from larger predators. Their biology is hardwired to deceive you. Hi everyone. I am Dr. Camille Sterling, Chief of Feline Preventative Medicine and Clinical Diagnostics here at Paw Secrets Lab. For the past 16 years, I have worked exclusively with cats. And I can tell you with absolute certainty, you do not need an MRI machine, an ultrasound probe, or a veterinary degree to protect your cat from catastrophic disease. What if I told you that by spending exactly 2 minutes, once a week, running your hands and eyes over your cat in a specific 5-point sequence, you could catch up to 85% of hidden feline health problems months or even years before they become irreversible medical emergencies? What if I told you that this simple weekly habit could save you thousands of dollars in emergency hospitalizations and add 3 to 5 healthy, pain-free years to your cat's life? Today, I am handing you the exact diagnostic blueprint. In Chapter 1, we will decode the evolutionary masking code and explore the biological mechanism cats use to conceal chronic pain and organ decay. In Chapter 2, I will reveal the Paw Secrets 2-minute head-to-tail health audit, the exact 5-point physical scan you will perform every Sunday morning. In Chapter 3, we will examine the 3 invisible home metrics that reveal silent kidney disease, diabetes, and arthritis before a single outward symptom appears. And in Chapter 4, I will give you the feline clinical triage matrix, the clear, definitive guide that tells you what requires a routine vet appointment versus what is a redline emergency that demands immediate hospitalization. Hit that subscribe button right now to join our global family of educated, proactive pet parents here at Paw Secrets Lab. Grab a notebook, look over at your cat, and let us build an early warning radar around their health right now. To understand why a weekly physical check is non-negotiable for a cat, you must first understand the unique evolutionary category to which your cat belongs. In zoological biology, dogs are classified primarily as apex pack predators. When a wild dog is injured, the pack protects them, shares food, and defends their territory. Cats, however, are solitary mesopredators. Because an ancestral cat, Felis libica, hunted alone, they had no pack to fall back on. If a wild cat limped, whimpered, or stopped grooming, 2 catastrophic things happened: their prey spotted their compromised state and escaped, leading to starvation. Larger predators in the territory identified them as an easy target and killed them. Over millions of years of natural selection, the feline brain developed a profound, automated survival program: active symptom suppression. The cortisol and endorphins shield when a cat experiences chronic pain, such as the agonizing nerve pain of a decaying tooth root or the burning nausea of early uremic toxins from kidney disease. Their central nervous system releases elevated levels of endogenous endorphins and cortisol. This neurochemical flood dampens the outward expression of pain. They will continue to jump up on the bed. They will continue to eat their kibble, often swallowing it whole without chewing to avoid touching a rotting tooth. They will purr when you pet them. Purring is not just a sign of happiness. In feline clinical medicine, purring is a well-documented self-soothing mechanism. Cats purr when they are giving birth, when they are in severe pain, and even when they are dying. The annual vet visit illusion. Most loving cat parents take their cat to the vet once a year for vaccinations and an exam. Think about what that timeline actually means. 1 human year equals approximately 4 to 5 biological years in the life of an adult cat. Relying solely on an annual veterinary exam to catch feline disease is the medical equivalent of a human seeing their doctor once every 5 years and expecting to catch aggressive cancers, progressive kidney decay, or heart failure in the early, reversible stages. Too much happens in the dark. By performing the Paw Secrets 2-minute audit once a week, you reduce the diagnostic window from 4 biological years down to 7 days. You catch the whisper before it becomes an emergency. Here is the exact weekly clinical routine. Pick 1 day a week every Sunday morning while you are having your coffee or during a relaxed grooming session. Perform these 5 physical checks in this exact sequence. Point 1. The gingival and odontoclastic sweep, seconds 0 to 25. Gently tilt your cat's head back with one hand, and use your thumb and index finger to lift the upper lips on both sides. You are inspecting for 3 critical markers: the mucous membrane color. The gums above the upper canine teeth should be a healthy, glistening, bubblegum pink. Pale/porcelain white indicates severe anemia, frequently caused by chronic kidney disease, fleas, or bone marrow suppression. Icteric/yellow indicates hepatic lipidosis, liver inflammation, or acute hemolysis. Muddy/gray signals poor peripheral perfusion and cardiovascular shock. The red line gingival margin, look at the gum line right where it meets the enamel of the teeth. If you see a bright, fiery red, bleeding line along the gum margin, this is severe gingivostomatitis. Forals, feline odontoclastic resorptive lesions. Look closely at the large premolars and molars in the back. Do you see a spot where the pink gum tissue appears to be growing into or over the tooth enamel? This is a resorptive lesion, a condition where the cat's own immune cells actively dissolve the tooth root from the inside out, exposing raw dental nerves. Over 50% of cats over the age of 3 have at least one of these agonizing lesions. Catching this early prevents months of silent starvation and pain. The scent check: take a gentle sniff of their breath. A sour, rotting smell indicates advanced periodontal infection. A sweet, fruity, acetone-like odor indicates diabetic ketoacidosis. A metallic, chemical, urine-like odor, uremic breath, indicates advanced renal failure. Point 2. Symmetrical lymph node palpation, seconds 25 to 50. A cat's lymphatic system is the primary battlefield where their immune system fights off infections, viruses, and cancers. You are going to check 2 major superficial lymph node stations, submandibular nodes. Place your fingertips under the jaw on both sides where the head meets the neck. Gently roll the skin between your fingers. Normal, smooth, soft, movable, smaller than a pea. Abnormal, hard, swollen, asymmetrical, or the size of a marble, signals dental abscesses, upper respiratory infections, or lymphoma. Popliteal nodes, reach behind the knee joint on the back of both hind legs. Squeeze the soft fatty pocket gently. If these nodes are enlarged and firm, your cat's immune system is actively fighting systemic disease. Point 3. The sacroiliac and spinal glide, seconds 50 to 75. Over 90% of cats over the age of 10 suffer from radiographically confirmed feline osteoarthritis, yet less than 10% are ever diagnosed by their owners because cats do not limp, they simply reduce their activity. Run your flat hands down your cat's spine, starting at the neck, traveling over the shoulder blades, down the thoracic vertebrae, and ending with gentle downward pressure over the lower back and hips, the sacroiliac joint. Watch their microreactions. Normal, the cat stretches, raises their rear end slightly, or continues purring. Pain signals, the skin along their back twitches or ripples violently, feline hyperesthesia/neuropathic pain. The cat drops their hindquarters suddenly to avoid your touch. Their pupils dilate, their ears swivel backward, or they turn and bite your hand. A dull, unkempt coat over their lower back and base of the tail, meaning they have stopped grooming that area because twisting their spine causes sharp joint pain. Point 4. The abdominal hammock assessment, seconds 75 to 95. place your cat in a standing position on a flat surface. Place one hand flat underneath their abdomen, right behind their ribcage, supporting their belly like a hammock. Gently lift and squeeze upward with soft, cupped fingers. Normal, the belly should feel soft, completely loose, and doughy. You should feel no resistance, and your cat should show zero discomfort. Red flags: the water balloon feel, ascites if the abdomen feels fluid-filled, taut, and pendulous. This can indicate feline infectious peritonitis, FIP, congestive heart failure, or internal tumors. The tense board: visceral pain if the cat immediately tenses their abdominal muscles into a rigid wall, arches their spine, or growls. Their internal organs are severely inflamed, e.g., pancreatitis, bowel obstruction, or acute hepatitis. The hard orange in male cats: if you feel a firm, hard, round ball about the size of a lemon or lime in their lower belly between the hind legs, this is a fully distended, blocked urinary bladder. This is an emergency room red line event. Point 5. Digital retraction and claw check, seconds 95 to 120, pick up each paw. Gently press your thumb on the top of each toe while pressing your index finger on the paw pad underneath. This mechanical pressure will naturally extend the claw out from its protective sheath. Overgrown dew claws: in senior cats who scratch less, the thick outer layer of the claw does not shed. The claw grows in a continuous curve until it punctures the paw pad, creating deep, agonizing, infected puncture wounds that require surgical debridement. Nail bed inflammation: paronychia: look at the base of the claw where it emerges from the skin. Look for dark brown, waxy, crusty discharge or raw, red tissue. This is a common early indicator of fungal ringworm or systemic autoimmune disease, pemphigus foliaceus. Physical exams are vital, but some of the most dangerous feline killers leave their very first footprints in your home environment. Every week, track these 3 invisible metrics on a simple notepad or phone app. The kitchen gram scale weight metric: do not weigh your cat on a human bathroom scale by holding them and subtracting your weight. Human bathroom scales have an error margin of 0.5 to 1 pounds. For an 8-pound cat, losing half a pound is equivalent to a 150-pound human losing 10 pounds of pure body weight. By the time you notice the change on a bathroom scale, the cat has already lost significant lean muscle mass. Buy an inexpensive digital kitchen scale or baby scale that measures in grams or ounces. Weigh your cat once a week on the same day at the same time. A slow, steady weight loss of just 2 or 3 ounces a month is the single earliest clinical warning sign of feline metabolic disease, appearing up to 12 months before blood work becomes severely abnormal. The litter box clump diameter index: when you scoop your cat's clumping litter box each day, you are looking at an exact physiological record of their renal and endocrine function. Take mental note of the size of their urine clumps. Normal, a healthy cat produces 2 to 3 spherical or oval urine clumps per day, roughly the size of a golf ball or small lime, about 2 inches in diameter. The pancake clump, polyuria: if you suddenly begin scooping massive, flat, pancake-sized urine clumps that take up half the scoop, 3 to 5 inches across, your cat is suffering from polyuria, excessive urine production. Their kidneys have lost the ability to concentrate urine, or their blood glucose is spilling over into their urine from diabetes mellitus. Catching a diabetic cat in the polyuria phase allows for dietary reversal before permanent damage to the pancreatic beta cells occurs. The microclump/multiple drops: if you find 10 to 15 tiny, nickel-sized urine clumps, or see your cat visiting the box repeatedly, straining, and leaving only a few drops, their lower urinary tract is acutely inflamed, feline idiopathic cystitis, or physically obstructed. The pre-jump calculation latency test: watch your cat when they prepare to jump onto their favorite high resting spot, the couch, the windowsill, or the bed. A young, pain-free cat approaches a surface, gathers their hind legs, and springs upward in a single fluid, instantaneous arc. A cat developing early lumbar or hip osteoarthritis displays pre-jump latency: they walk up to the couch. They put their front paws up on the vertical cushion. They look up at the top of the couch, look down, look up again, and hesitate for 3 to 5 seconds, mentally calculating whether their back joints can handle the impact. When jumping down, instead of leaping straight to the floor, they search for intermediate steps, jumping from the bed to a chair, and then to the floor. When their paws hit the floor on a landing, listen closely: does it sound like a silent, cushioned landing, or a heavy, flat thud? A heavy thud indicates their carpal and tarsal joints are no longer absorbing shock properly. Now, you have completed your weekly check. You noticed something slightly irregular. How do you know whether this requires a routine call on Monday, or whether you need to put your shoes on and drive to the emergency room right this second? Use the Paw Secrets Feline Triage Matrix. The Feline Saddle Thrombus Alert: I must give you one specific warning about heart disease in cats. Cats rarely cough when they have heart failure. Instead, hypertrophic cardiomyopathy, HCM, causes blood clots to form inside their left atrium. These clots can dislodge, travel down the aorta, and wedge at the bifurcation of the femoral arteries, a catastrophic event called a saddle thrombus. If your cat suddenly cries out in agonizing pain, collapses, and cannot move their rear legs, their back paws will feel ice cold to the touch and their rear paw pads will look pale or bluish. Every second counts. Transport them to an emergency facility immediately. I want you to look back over at your cat. They are small. They are silent. They live in a quiet, stoic world where showing pain is a danger they were taught to avoid by 10 million years of evolutionary programming. They will never come to you with a tear in their eye and tell you that their molar feels like a hot needle every time they crunch a piece of food. They cannot tell you that their kidneys are struggling to filter the toxins in their blood. They cannot tell you that their lower back aches every single time they jump down from that chair. They carry all of it in silence. And they trust you. They trust that the human who fills their bowl, who cleans their box, who strokes their fur while they purr, is paying attention. They trust that you are smart enough, observant enough, and loving enough to see through their evolutionary mask. When you spend 2 minutes every Sunday morning running the Paw Secrets 5-point scan, you are honoring that trust. You are stepping into the role of their true guardian. You are ensuring that diseases are caught when they are small, manageable, and curable, not when they are catastrophic, painful, and expensive. You are giving your best friend the greatest gift a human can ever offer an animal, a long, vibrant life free from silent suffering. Starting this Sunday morning, take 2 minutes. Lift those gums. Feel those soft lymph nodes. Check that spinal glide. Weigh them on that kitchen scale. Be the protector your cat believes you are. Now, I want to hear from you. Have you ever had a cat diagnosed with a hidden illness that seemed to come out of nowhere? What was the diagnosis, and looking back, what was the tiny whisper sign you wish you had known how to read? Share your stories down in the comments below. Your comment could be the exact piece of clinical insight that helps another cat parent catch a silent disease in their pet this weekend. If this masterclass gave you real confidence, practical clinical tools, and peace of mind today, please gently tap that like button. It signals the YouTube algorithm that real, research-backed feline veterinary science deserves to be seen, and it helps us protect cats and support pet families all over the world. Make sure you hit that subscribe button to join our amazing family of educated, empowered pet parents here at Paw Secrets Lab, because we are dropping deep dive clinical masterclasses every single week. I am Dr. Camille Sterling. Check those pink gums this Sunday. Track those urine clumps. Keep that spinal glide gentle and soft. And I will see you in the very next masterclass.